Well, let's get more on this from Stephen Northrup. He served as the Republican Health Policy Director for the Senate Committee on Health, Education, Labor, and Pensions. He joins us live from here in Washington. Stephen, great to have you back. We really appreciate it. The president, of course, has been threatening to pull funding for the WHO unless within the next 30 days they see some substantive improvements. What do you think in detail change looks like for the president?
Well, first of all, Kilmeny, the president doesn't have the ability to unilaterally and permanently end funding for the WHO. Congress has appropriated these funds, and there's some question as to the extent to which the president can hold on to these funds for much longer. But the bigger question is, for the United States government, what does an inquiry look like into the actions of the World Health Organization, and in particular, the concerns that in mid-January, the WHO took at face value the claims that the Chinese government suggested there was no evidence of human-to-human transmission. And I think that is really the key issue that the United States government is focused in on. And why did the WHO take China's claims at face value?
Do you think that the U.S. should cut funding in the process while it tries to resolve those answers?
Kilmeny, this is a global pandemic. It's a multinational crisis, and it really does require a multilateral solution. I don't think it makes sense to cut funding in the middle of this crisis. The WHO depends heavily on funding from the United States, nearly $1 billion in the last 2 years of funding from the U.S. There will be plenty of time after this crisis passes to conduct an inquiry and to figure out what, if anything, went wrong and what to do about it and how to proceed. But at this point in this crisis that's affecting all 194 countries in the World Health Organization, now is not the time to pull the United States and its funding and expertise out of the organization.
Stephen, how much of this is about the Trump administration pitting the blame on the World Health Organization for its initial handling of this pandemic? And how much of it is it about this administration pulling away from the typical leadership role that we have seen America have in these critical organizations around the world?
I think this is evidence or another example of the administration looking to act unilaterally when it thinks that it's in the best interest of the United States for it to do so. Certainly, the WHO's actions early in this pandemic make the focus, rightfully so, on its own actions. But again, you can look at this as evidence of the administration moving unilaterally, but there's legitimate frustration, and it's not just the United States that is frustrated by the WHO's actions. There were dozens, if not scores, of countries who shared the United States government's concerns about how the WHO handled the pandemic in the first place. But ultimately, it's up to the member states of the WHO to decide how to handle this. The WHO is a membership organization of 194 countries collaborating together. And together, they're going to have to conduct this inquiry to figure out what went wrong and how to move forward.
Absolutely. Stephen Northrup, great to have you back. We really appreciate you coming on.